Welcome back. May is Mental Health Month, and here with more about Colorado's Let's Talk campaign is Angela Green. Angela, thanks for being with us.
Thank you for
I was just mentioning it, you match perfectly with our set. We're just going to have you back because you can match. All right, tell us about your role and everything you do to try to address this issue.
Sure. My role at Metro Community Provider Network is as the Director of Behavioral Health. And what we do there is we ensure that there is access to behavioral health services for our patients that come there. In addition, I'm a licensed clinical psychologist, and I provide some of those services to our patients.
Well, let's go ahead and plug the number that we want to get out there, because if you or someone you know needs help, might need to talk to someone, you can call the number 1-844-473-TALK, or you can go ahead and also text TALK to 38255, which is so important. I just wanted to get that out there for everyone watching. All right, now you talk about integrated care.
Yeah.
What does that mean, and why do you use that approach?
We use the integrated care approach because we really believe that whole person wellness includes emotional and psychological well-being. And so integrated care is really attaching the mind to the rest of the physical body and making sure that we're addressing the whole wellness of the person.
That is important. Was there an inspiration behind this that made you sort of go in this direction?
About 12 years ago, Metro Community Provider Network, or MCPN as we like to call it, made a conscious decision to really do this integrated care type of philosophy, because we saw patients who were coming in who were dealing with financial crises in their lives, divorce, as well as the usual physical health things that might go on, cancer, or having just to do something different in their life because maybe they were diagnosed with diabetes. That means some behavior change.
Right.
And so we had the patient right there. Why not bring those services to them so that way they didn't have to go somewhere else?
So how has this helped them then overall? How has this approach helped?
We've heard many patients talk about how nice it is to have this integrated service, because also at MCPN we also provide dental as well as primary care.
Oh, okay.
And so it's a one-stop shop. They can come there and get their physical health, their dental health, and their behavioral health needs met all under one roof.
So it sort of makes sense that you'd partner with Let's Talk campaign, right?
Yes.
Tell us about that partnership.
Sure. So the Let's Talk campaign is really about getting the message out there how mental health is part of your overall health, and really reducing the stigma around mental health being something that's scary or taboo to talk about. And we just want everyone to know that really when we're talking about total health and wellness, you can't ignore the emotional and psychological piece of that as well.
It is so important. So if the people are out there and they're thinking, well, I don't have a doctor or a physician to talk to, that's not really what you're saying, right? You're saying it's important to talk just to anybody.
That's right. You can talk to anyone, just being able to have a conversation. And maybe if you're the person that's experiencing that mental health issue or challenge, if you have a friend or a family member that you feel really comfortable with talking to, just go and talk to that person. Or if you're that friend or family member and you notice that someone isn't being their usual self, don't be afraid to ask. Be direct, and then just listen. Listen to what they have to say. Just listening to what that person might be going through can make a huge difference in that person's life. And that's a lot of what the Let's Talk campaign is about.
Well, and if anyone is at home listening to this, and if it's ringing a bell at all or touching a nerve, please listen, because there's a lot of misconceptions about mental health out there. And you guys really just sort of want to make sure that everyone there realizes there's not that stigma attached to it, right?
Absolutely. Mental health, behavioral health, all of that can be something as simple as life transition or stress or sleep issues, as well as some of the mental health or substance use disorders that might also be occurring with someone.
Absolutely. Now, some of the challenges, I mean, everyone has, I think, mental health issues that we deal with on a daily basis. You wake up one day, you feel better, sometimes you don't. What are some of the challenges that for good mental health that we have to keep in mind?
We have to keep in mind that we all have very busy lives, and some of those things on any given day might really be tough on us, and we can be completely exhausted towards the end of the day. And just one little simple thing, the trash didn't get taken out, or the dog's barking because he wants wants to be fed. That just might feel overwhelming to us.
Right.
And just taking a break and being able to have a conversation with a friend, or that friend just saying, hey, what's going on with you today, can make a complete difference in a person's life.
We actually have a spot from the Let's Talk campaign. Let's take a quick look.
It's been a really tough week.
Do you need to talk?
The world around us affects our mental health, and our mental health affects the world around us. But getting help does help.
Do you know a good therapist?
Yes, I do.
Whether we talk to a friend or to a healthcare professional, starting the conversation about mental health can lead to brighter days.
I've seen this before and I love this. It really does touch a nerve for so many different things, because it asks questions like, is this you? It's okay. So when you see that out there, if someone's watching again, what do you want them to know? What do you want them to do? Like I said, if this is touching a nerve or it's someone they're worried about even at home.
Sure. I want them to know, ask. Just really ask, and then listen. Be direct with the person that you might have a concern about, and just sit with that person. Check in with them about that. Listen to what they have to say. And the phone number that we have already shared with you, that is something that both of you can call, whether you're the person asking about the well-being of a friend or a family member, or if it is the person who is experiencing the mental health challenge. You can definitely call those phone numbers for additional resources.
Well, you have been a pleasure to talk to. We appreciate you being here. The Colorado Crisis Services is open 24/7, and the number is 1-844-493-TALK, or you can text TALK to 38255. Another wonderful and quick resource is online at letstalkco.org. This website also offers proper guidelines in case you need to start a conversation with others about mental health. We'll be continuing this conversation and taking your questions live on Denver 7 Facebook page after the show. Stay with us.
There's no perfect way to talk about our mental health, but that's why we should talk about it.
Hey, how are you feeling?
Yo, let's catch up.
Mental health is simply the health of our mind.